Welcome back to Family Health Today. I'm your host, Dr. Janette Nesheiwat. The human body's integumentary system, or our skin, is the largest organ system of our bodies. But how often do we think of the health of our skin? Oftentimes, skin health only comes as an afterthought, many times brought to mind because of discomfort or skin injury such as a sunburn. But overall skin health care is more important than many of us realize, and it must be thought about year-round. Well, joining us to talk about how we can better care for our body's largest organ is Dr. Missy Clifton from Premier Dermatology in Bentonville. Welcome, Dr. Clifton. Thanks for being here today.
Thank you for having me.
So tell us, what does the integumentary system include?
Well, it includes the skin. It also includes the hair, the nails, the glands that serve the skin, like the oil-making glands and the sweat glands.
All right. And why is skin care and taking care of our skin so important?
Well, really, your skin protects the rest of your body. It is there basically to keep you thermoregulated, keep you warm, keep you cool. It's there to protect you from infections. It's there to protect you from all of the environment.
Sure.
And so if you let your skin break down, lots of problems can arise from that.
And you know, a lot of people think, oh, they only need to worry about their skin during the summertime and wear sunblock out in the sun. But you can develop serious skin problems during the wintertime as well. I know even if the sun isn't shining, you know, UV rays are still out there and it can cause damage. Is that right?
That is very true. And actually, I had a little boy come into my clinic just today. As you know, we've had a lot of snow here lately.
Sure.
And he was out sledding for about 3 hours.
Oh, bless his
and
heart.
part of his face was uncovered, and he had a horrible sunburn. And it's just not something that the mom thought about because it was kind of a cloudy or overcast day. But 80% of the sun's rays penetrate through the clouds. So.
And prolonged exposure, even during the winter, can then also turn into basal cell carcinoma, squamous cell carcinoma?
Absolutely. Sun damage, regardless of the time of year, can be anything that can lead to precancerous changes.
And what about like frostbite to the skin? That can be dangerous, prolonged exposure to the cold temperatures?
Absolutely, especially with the really cold weather that we're having this winter. You really don't need to be out more than 10 or 15 minutes a lot of times without having all of your skin covered.
Sure. What do you recommend to help keep the skin hydrated and moisturized during these winter months? Especially not just for women. A lot of people think, oh, just women need to wear moisturizer, but it's for everyone. Is that right?
Absolutely, absolutely. It's not just the girls that need to be putting on lotion this time of year. And really the key is to avoid things that are really harsh and drying. A lot of the antibacterial soaps and a lot of the kind of fragrance soaps that are really deodorant type soaps are really harsh on the skin, and we should really avoid those. Go for something like unscented Dove or Cetaphil. And then go for one of the moisturizers these days that have what are called ceramides. There's lots of them out there. There's Cetaphil Restoroderm, Eucerin has one, that all kind of put the barrier of protection back on the skin so that not only are you moisturizing, but you're kind of protecting as well.
Sure. And would you say that taking hot showers, for example, can actually cause more harm to your body? People think take a hot shower, then slap on the moisturizer, but that heat, what does it do to the skin?
Well, heat and prolonged moisture. You know, sitting in a bathtub a long time, especially a hot one, is really going to pull the moisture out of your skin. And so really you do want to take, you know, shorter, and, you know, not cold, certainly, but not the hottest showers as well.
Dr. Clifton, during these winter months, what are some of the most common type of skin problems that you see?
Oh, the most common thing that we see on a daily basis right now is eczema. Or atopic dermatitis. Which usually just stems from people having really sensitive or dry skin, and then they maybe put the wrong thing on it, something with a lot of fragrance or something that then irritates it even more. So we see a lot of that.
But the normal over-the-counter products, like you mentioned earlier, like Cetaphil,
and
fragrance-free moisturizers.
Exactly. Those are great places to start. Even just a little over-the-counter hydrocortisone, if a place is really, really irritated, is a great place to start. And if those things are not calming it down, go look for, you know, prescription-type medication.
What about other skin conditions such as like psoriasis or rosacea? Do those type of disorders become worse during the winter as well?
Frequently we do see worsening of those disorders. Psoriasis in particular does tend to be a lot worse in the winter. A lot of times because the sun is a little anti-inflammatory and there's less of that in the winter.
same sort of treatments? Keep the
Same
skin-
sort of treatments. You definitely want to lubricate, really put that barrier of protection back on. And a lot of people really do have to step up their prescription medicines in the winter for psoriasis.
Sure. And if those conditions aren't treated, the skin can crack and bacteria can enter the skin
Correct.
and cause infection as well. Is that right?
That's absolutely correct. With eczema, with any kind of disorder where the skin gets really, really dry, eczema or psoriasis, it can lead to increased risk of skin infections.
Sure. At what point should a patient decide this isn't getting better, this is getting worse? When should I go see a physician, see a dermatologist, for example?
I would say after a week to 2 weeks of using the over-counter preparations, if that's really not helping, or especially if you start to see a lot of redness or swelling around the site, if you start to see little pustules or little pus bumps, that could be the sign of an infection starting, and definitely you need to seek care for that.
Okay. And who do you see these skin conditions in mostly? Is it mainly children or elderly people?
Actually,
Or
this time of
it's
year,
just
we see
everyone?
people of all ages with these problems. And we do see a lot of guys, and I think that
Really?
is part of it, that guys don't think about getting up and
Sure.
putting the lotion on like a lot of
Absolutely.
women do.
Especially on their faces and their hands.
Exactly. So we see all ages, all sexes this time of year.
Is there any particular ethnicity or nationality that you see is more prone to these sort of skin conditions?
Well, I do think that atopic dermatitis or eczema seems to be more common in the really fair-complected people
Sure.
of, like Northern European descent. We do seem to see a lot more of that, but I've seen kids and adults of all nationalities have some of that.
And would you say, for example, a patient that has asthma or an underlying medical condition would be more prone to having worsening case of skin rashes?
In
and
some
eczema?
cases,
Is
that's true. A lot of kids that have atopic dermatitis or eczema tend to have a lot of history of allergies or even asthma as well, or family history of that.
How important is it to be hydrated by drinking a lot of water? A lot of people say, oh, I drink coffee and tea and lots of soda and juice, but really you just need pure, fresh, clean water to keep your skin healthy. Is that right?
Well, water is what makes your whole body healthy.
Exactly.
It helps to flush out all of the impurities. And so putting moisture on the outside is good, but also hydrating with things that don't have a lot of toxins, a lot of caffeine, and that kind of stuff can definitely help.
So what would you say is important as far as diets? I know drinking water is important, but as far as foods, if someone, for example, eats a lot of fatty, greasy foods, we would expect them to have a lot of acne or be more prone to acne?
Well, there are a few myths in that realm. There are only a few foods that have actually been associated with acne. Really,
Chocolate.
Dairy products.
Dairy, right?
Dairy products
Yes.
are way up there. So people that drink a lot of milk, a lot of cheese, a lot of chocolate. Though chocolate is actually considered a dairy product. So we do see that. Fatty foods, not necessarily. It really tends to be more the people who work in the fast food industry and have more grease on top of their skin that is making them worse in that regard.
Those fatty foods may not.
Those fatty foods may not be so good for the rest of your body.
Exactly. That's exactly what I was just going to say. So can you just tell us about some preventative steps besides using moisturizers? What are some preventative steps to take care of your skin if you're heading outdoors or going to work?
I think it's just a great habit for all sexes, all ages, to find a really good just daily moisturizer that has some sunscreen in it. Just get in the habit of putting it on every day before you go out. It's going to have some moisture, it's going to protect your skin from that regard, but it's also going to have some UV ray protection. So if you do forget to really put on a true sunblock, at least you have a little bit of that protection going.
And if anyone happens to notice a change in their skin, or it's not getting better, or they notice a change in a mole, like a change in size or color, or irregular borders, that's a sign of possible skin cancer such as melanoma. Is that correct?
Absolutely.
And at that point, they should go in and either see their family doctor or a dermatologist such as yourself?
Right.
All right.
And there are several things to look for. You look for lesions that don't heal, lesions that bleed easily or sting, and then, like you said, any mole that changes color or shape.
Do you see most of it on the nose or the ears,
Actually,
just everywhere?
with basal cell and squamous cell, the most common types, we see a lot of those on the face and the chest and the arms where there's been a lot of sun exposure, but melanoma can actually occur anywhere on the body.
And would you say you're seeing that in more younger patients these days as
Unfortunately,
well?
we see a lot of patients in their 20s and 30s now with melanoma, which I think is probably due to a lot of us trying to have tan young,
Absolutely.
and also tanning beds,
Yeah.
which is not safe.
So sunblock in the winter months as well.
Absolutely.
All right. Is there a website or a place where our viewers can go to get some more information?
Absolutely. Our website actually is premierderm.net, and it has lots of links to the American Academy of Dermatology, the National Psoriasis Foundation, lots of other links that can give you a lot of information.
Very good. Well, thank you so much for joining us here today. We appreciate it.
Thank you. Thank you for
All right.
having me.
Absolutely. Stay tuned. Family Health Today will be back in just a moment.